what I think those of us who didn't put pronouns in our email understood and why people were so insistent that we do this is that it was a way of signaling fealty to a belief system. And the belief system is supported only by belief. And would not stand up to scrutiny. So fealty to the idea becomes extremely important because the ideology is so weak that it can't stand scrutiny.
Welcome to the Reality Therapy Podcast, where the truth will set you free.
Welcome. I'm here today with Dr. Aaron Kindsvatter, who is a licensed mental health counselor, former counselor educator, and co-founder of the Society for Ethical Practice of Psychotherapy. And I think we're going to have a great conversation. So welcome.
Thank you, Ryan. It's nice to be here.
So let's start off. Tell me about who you are and your background.
Okay. Well, so I first became interested in mental health and had my very first mental health job in 1995 and decided that I should go and get a master's degree. And I was really, really enamored with counseling, and my professors, while I was working on my master's degree, said, "Hey, you should really get a PhD." And I became enamored with that idea, so I did that. I went and got my PhD, and then was a counselor educator from 2006 until 2020. And I left higher education as a tenured professor, and I decided to leave counselor education because of the political trends that were occurring ubiquitously within counselor education. I wouldn't say it was a difficulty with one institution per se, but the availability of the literature that and the expectations of what would be taught in counselor education were such that I just sort of felt like the profession was no longer right for me. So I left my tenured position to start my own private practice first in Burlington, Vermont. And then just recently, my wife and I have moved down to St. Augustine, Florida, which is, I'm talking to you today from my office in St. Augustine, Florida.
Oh, wow. That's an interesting journey. I want to go back a little bit to like when you first started noticing the politicization of the field. I know for me personally, walking into, some of my first classes in my first semester, again, this was a little bit later. This was 2022, fall of 2022, when I had my first classes in grad school. But we're saying our pronouns, we're doing privilege walks. I had a professor who says, one of your primary objectives as a therapist is to become a political activist so that you can, quote, burn it all to the ground. So I'm having these moments where I'm like, does anyone else notice this? Toto, we're not in Kansas anymore. I'm wondering, like, your personal psychology, what are you going through, like, as you're seeing some of this?
Dismay, disgust. It's a loss for me personally to see the antics that are taking place in the profession. There's a question that I used to ask myself, even as a very young child. I first heard about the Holocaust in Germany. What was the matter with the people in Germany that they could allow themselves to hate a group of people so much that they would essentially try to exterminate them? And I always thought that there must be something wrong with the people in Germany. And as I've watched what has happened with critical social justice and the ease with which critical social justice has moved through the institutions, as a late 40, early 50-year-old man, I think I finally figured out that there was nothing wrong with the people in Germany per se. People in general are just incredibly susceptible to terrible messages as long as A, they are cloaked in appealing language, and B, conveyed by charismatic leaders. And, probably C is that everyone thinks everyone else agrees with those leaders, and so they go along. So it's been dismaying to watch the degradation of the profession. It's been dismaying to watch people go along with it. And it's been dismaying to see how easily the profession and universities sort of rolled over for this ideology. The lack of courage, the lack of a willingness to sort of stand up to this and to say no has been truly awful to witness. So that's not a very cheery thing, but it really changed my outlook on life watching this occur. And I think I started to see it sometime around 2013 or so.
Funny th that's so bizarre to me because, like, for me, I noticed a little bit of it here and there, but it was 2020 when it really was, like, right in front of me. But people who were on the inside, like in academia, you started noticing it much earlier than the rest of the population.
Well, I think it became very apparent first in the universities where you started to have the emergence of what's termed bias response teams. And really what they are is they're like the Soviet era political officers. They're there to, ensure that they're there to set parameters for what constitutes, an appropriate discussion or appropriate ways of relating. And on the surface, you might look at that and say, hey, they're just there to protect the vulnerable. What's wrong with that, you monster? Why would you object to that? But you look a little deeper and you see slowly they're there to eat away at the foundations of liberalism. And which is to say that they are there to eat away at the foundations or to narrow the parameters of acceptable thought. And you've been able to see since about 2013, 2014, when bias response teams first became apparent on university campuses, you can sort of look at the narrowing of thought that has occurred over that time to the point where we went from bias response teams in 2013 to in 2024, 2025, people are saying with no guilt and great amounts of enthusiasm, they're talking about the dirty Jews on campus, and it was sort of a natural progression. I want to just say I don't mean here to conflate what happened in Germany to what is happening now, but I am suggesting that the same kind of circumscribed thought process and the utilization of our tribal impulses is common among what happened in Germany and what's happening now.
I 100% agree with that. And obviously, it hasn't been as violent as Nazi Germany, but there is this connection here where there was two Jewish intellectuals I'm thinking of from the Frankfurt School, and Horkheimer and Adorno, and they're essentially responding to the Nazis by saying we should go in the opposite direction of that, which they thought was this form of Marxism called critical theory. And you kind of trace that critical theory all the way back to contemporary college campuses, where now we need to decenter Jewish privilege, and it's like we're
Right.
back where we started.
Well, and it's like anytime you point at a racial group and say, there's the problem, if people are pointing fingers, it's already fashionable within that society to do that. They're not taking a risk by doing that. What they fail to understand is that even though it seems fashionable and cool and edgy to be on campus and to say, well, look at all that whiteness, which was probably going on in about 2020, was when whiteness and multiracial whiteness became sort of fashionable on campus. What they didn't stop to think about is that the underlying process there is one of racialization. And what you're doing is you're celebrating racialization. You're holding up racialization as an engine of social change. So all the people who are going around talking about whiteness this and whiteness that, what they don't realize is that they are advocating for a way of thinking that is incredibly dehumanizing and that's incredibly dangerous and that will get away from them. And that's what happened in sort of 2020, that there's this real push against whiteness, and then now that's extended to a push against Jewish people. And, I'm sure that there's been lots of pressure towards Asian people because Jewish people and Asian people are, you know, uh, white adjacent. And so what you see though going on is the activation of these very base tribal impulses for purposes of rapid social change, which is gratifying for the activist, but it's an incredibly stupid thing to do. It's an incredibly dangerous thing to do because what you're saying is that this is a good and acceptable means of change, which, which runs in the face of everything we should understand about ourselves since the time of the Enlightenment.
When you were a counselor educator, I'm wondering what type of things you started seeing from your fellow faculty members that you thought were troubling.
Well, I can't talk about the faculty members, specifically. What I can talk about are trends in the field, which, the trends in the field were what I was seeing at work from day to day. I think the first troubling, trend that, I saw was there was this subtle shift around 2010, and then it took to about 2013 to sort of make its way throughout academia. And the shift was this, that that impact over intent became the norm. So this was in response, I think, to some of Daryl Wing Sue's work on microaggressions. But he wrote an article in a very prestigious journal. I'm a little surprised that it got accepted in such a prestigious place, but he wrote this article on microaggression in which he frequently uses the term perpetrator and victim to describe non interactions between people of different races where there was no intent to be racist. And Ivy, or I'm not Ivy, Sue is claiming in this article that that was in fact racism. So that sort of began the start of a almost kind of a witch hunt atmosphere, because now anyone, irrespective of their intent or their beliefs, could be accused of racism. And at the same time, what are termed microaggressions were conflated to be as bad as the kind of blatant awfulness that you might have seen in Nazi Germany, or the time prior to the civil rights era in America, where, blatant racism was conflated with, an awkwardness that tends to come with meeting someone who's different from you and, asking where they're from, uh, or professing one's belief that America is a land of opportunity. So that was the beginning where, um, where simple faux pas or perceptions that fell outside of a progressive narrative were then considered to be racism, irrespective of a person's intent, because it was claimed that the impact of the beliefs were in and of themselves racist. And so during that time, student engagement around these issues drops way off because everyone's afraid to open their mouths. The acceptable parameters for conversation then become extremely narrow because everyone's afraid to stand up and say, "Excuse me, wait a second, I don't agree with this."
Mhm.
Because one could be doing that would, in effect, constitute racism.
I'm wondering if you could comment for a second. I don't know how to phrase this exactly, but there's a certain ambiguity around it. Like the language tends to be vague a lot of times and unclear. And there's this kind of uncertainty in the atmosphere. It's like you don't even want to ask for clarification because asking, you're putting emotional labor on someone to explain it to a white man. Like almost anything could potentially be bad, and you don't even really understand the dynamics of what's going on. So it's just safest to keep your mouth shut a lot of times. You
Right.
see that?
Yeah, I see that a lot in abusive relationships as a couples counselor. The same ambiguity is there. And what's happened is, this is another thing that's happened, and critical social justice is predicated on the idea that truth and equality are not what we should be pursuing in higher education and counseling. What we should be pursuing is the power differentials between people. So when you start to see the emergence of vague language, when racism can mean virtually anything, um, when there's harsh rebukes based on vague accusations, what has happened is that there's been a fundamental shift where language no longer provides precision of thought, and language is no longer important because it signifies the search for truth. Vagueness of language is now important because it allows for the exercise of power. So the vagueness of the language is very, very intentional. And that's why asking for definitions, your response to it is almost always, it's not my job to explain to you as a blah, 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 why this is true. And what that person is doing in lieu of an actual explanation, which they do not have, it's just an appeal to power. It's an intimidation tactic. So I see the exact same thing in dysfunctional marriages. It's not for me to tell you what you need to fix. You should understand that already. I hear that. I hear that. I hear that dynamic all the time
Mm.
in dysfunctional relationships where one person is trying to gain the upper hand rather than relate in good faith.
That's so fascinating. I have another hypothesis that I want to run by you, and I'm trying to flesh out how to word it. So bear with me here. It felt like there's a big selection bias in who gets admitted to these programs as students. I don't think we weren't required to take GRE or anything like that, but there was definitely a question about what are you contributing to social justice and that type of thing. And it felt like on most of my classes, on the first day of class, the professor would do something to kind of set the tone.
Uh-huh.
It could be say your pronouns, do a privilege walk, say the word social justice and diversity 30 times, whatever, they set the tone. And then for pretty much most of the rest of the semester, the professor kind of backs off and the students are policing the boundaries. I'm wondering if you saw that.
I can't comment on whether I saw that, but I understand it and I see it. And I definitely saw it in higher education, and I've talked to a lot of people about the phenomenon. And that's all part of again, all of this is about the manipulation of power. And what the professor does is on the initial night, is set the tone for and using their power and influence as a professor to set the tone for what will be considered in the group to be the good. Okay. The students then begin to act, the group dynamics begin to act then on that reality. And the nature of groups is that the first thing the group wants to do is identify members and non-members. And non-members then become excluded and looked down upon and are considered a threat to the in-group. And it does not matter at all if there is anything actually good about the in-group. There's a fascinating study that was done where groups of people were separated and then given red shirts and blue shirts. And then what they did was observed, and then they were observed and they weren't given any further instruction. And they naturally separated themselves out and then formed negative views of of people based on whether they had a blue shirt or a red shirt. So people are groupish by nature. So what those professors, critical social justice professors, understand this really well. And so they understand that if they can get the ball rolling and and one of the things that counseling students are probably come into the program being vulnerable to is that they have, Jonathan Haidt talks about this in his book, The Righteous Mind. They have a moral impulse towards preventing harm to people. So probably what the professor does on the first night, and I've seen this and I've heard this a million times, is they subtly inject the idea that going outside of parameters of thought that are implicitly stated constitutes harm to the vulnerable. So all they need to do is to do that. They just need to convey that, and then they need to set up some kind of very minor compliance ritual. And that might be saying your pronouns, that might be doing a privilege walk or whatever. You just need to set the parameters for circumscribed thought and a way to identify who's in the in group and who's in the out group. And then the group will do the rest, and the professor can just kind of sit back And it's a very safe thing for them to do that, because then they won't be questioned, they won't be scrutinized, the group will take care of itself. And so the manipulation starts, and it's not a hell and brimstone lecture, although I'm sure there are some of those, but mostly it's just manipulating the moral impulses of vulnerable young adults and then letting the group process take over. And that what I can tell you for sure is that message of what constitutes harm. What I've heard said before is, you come in on the first night and somebody will say, it doesn't, they'll throw out the Robin DiAngelo thing. It doesn't matter if you think you're a good person. It doesn't matter if you think you're not a racist. If you're white, you're racist. And, that is said. And then almost nothing else needs to be said. You would just need to allow the group to take over, because at that point, you're no longer dealing with the pursuit of truth. You're dealing with the pursuit of belief, and people will believe on their own, and they will believe what the group tells them to believe.
So you brought up Jonathan Haidt's moral foundation theory. I'm trying to remember. I think there was like conservatives typically use 5 moral foundations and
Right.
liberals use 2.
Right.
I want to get your opinion on this. To me, that seems a little outdated because he's studying kind of traditional liberals. I think this was, what, 10 years ago or maybe more. It seems like woke or critical social justice, your Marxian influenced identity politics have definitely this sense of purity. And
Yeah.
I would say, if you saw, especially around
Exactly.
trans issues, when you saw like the people leaving streak marks on the pride flag in
Yeah.
the street, that was responded to similarly to the way a conservative would respond to like burning an American flag, or a Christian. I don't know if you remember the guy who dumped the crucifix in the jar of
Yep.
urine, right? So they're having a very similar type of response that's very different from the way traditional liberals would respond to these type of things.
Yeah. I think the purity spiral is certainly in there, and it's interesting. I think Haidt He did I forget how he talked about this, but he did say that there was a difference between liberals and progressives, and I think he teased that out in a chapter that's in there, but I think it's probably time for a second edition of that book, because there certainly is, and I think this is part of the group process, and here's where it may differ. Purity, people who have a moral impulse towards purity really are concerned with the infection or the intrusion of something that's dirty or hurtful. So progressives in Burlington, they needed a special grocery store that had like only organic, tomato paste and organic cleaner and so forth. And that was a purity kind of thing. And you'd see the same kind of purity in the Deep South, where, adherence to certain ideas about sexuality, there was that same issue around purity. And I think where there might be a difference is that the sociological and psychological phenomenon behind group adherence also creates a kind of purity spiral, where you need to identify who are the dangerous people and who are the safe people. The safe people are the ones who are proclaiming their belief and their group membership the loudest, and the dangerous people are the ones who are staying quiet or pushing back or who are not putting pronouns in their email. So
Mm.
both of those in some way involve the concept of purity, but I wonder if they have the same underlying substructure. I'm not sure. It's a fascinating question. I wonder what Haidt would say.
Yeah, that is interesting. Here's another thing that you would have to speculate on because I don't think there's any way to know completely, but I feel like there's true believers and there's people who just go along with things. There's people who would kill or die for the cause. They're absolutely just foaming at the mouth, rabid fanatics. And there's people who put their email or their pronouns in their email sign off because that's what we do here. In the
Right.
same way that an atheist says God bless you because that's just what we say. I'm wondering, like, if you could speculate what percentage of faculty generally are true believers versus just kind of going along with the crowd.
I think the people who are not true believers would be higher than people would expect. I think there is an epidemic of cowardice among faculty members. And so a lot of them do just go along to get along, and they minimize the impact of things that they're doing. For example, a lot of people put pronouns in their email without really thinking about what the ramifications of that might be, because their thought process stopped with, this is a way to be polite to trans people. What I think those of us who didn't put pronouns in our email understood, and why people were so insistent that we do this, is that it was a way of signaling fealty to a belief system. And the belief system is supported only by belief. And would not stand up to scrutiny. So fealty to the idea becomes extremely important because the ideology is so weak that it can't stand scrutiny. So then signals of fealty to it become incredibly important, because that's how you keep it safe. That's how you keep it insulated from inquiry. That's how you perpetuate the ideology, is to make sure that questions aren't asked, that points aren't made, that you maintain unquestioning belief.
Mm.
And so I think there are relatively few true believers, although over time, I'm sure that has gone up some, because the process is so selective. It's, the parameters for what they're looking for in counselor educators now are so narrow that they're pulling, they hope, I think, from a pool of only true believers. And
Mhm.
so the number of true believers has probably increased some, but there just aren't that many people that are capable of that level of self-deception, which it gets back to the point that I was making earlier, though. If they're not able to deceive themselves through true belief, they are willing to allow for a very destructive ideology to flourish in the name of cowardice.
Mm.
And that is almost as dismaying as if the true believers had increased tenfold.
Mm.
Yeah, at some point, counselor educators and the profession of counselor education is going to have to take a long, hard look in the mirror.
It almost feels like the more ridiculous something is, the more social capital is given to you for going along with it. There was a trans identified male in my school who would always say, we're here in Texas, would always say, Texas better not take away my right to an abortion. And everybody just kind of goes along with, yes, we're fighting for you, you know? The more ridiculous something is, because anybody can go along with something that makes sense.
Uh-huh.
I think it's kind of that true believer mentality. You're really showing your devotion to the cause if you're like going out of your way intellectually. Does that make sense?
It does. I think in cases like the one that you're describing, another element that plays in is something that was described by, I forget whether it's Manning and Campbell or Campbell and Manning, but which is victimhood culture. And so someone will make claims to being in danger for something that they're clearly not. And, I think you start to see this with the concept of microaggressions. And then that's just gone exponentially. So people would talk about microaggressions as if, you would have to go to the hospital because you
Mm.
had experienced too many microaggressions or something. But it's predicated, or it's informed by the, by the emergence of victimhood culture. And victimhood culture differs from honor culture, in which a person needs to protect their good name, or I forget what the other one is called, but we'll call it dignity culture, where someone perseveres in spite of the fact that someone might say bad things about them, because they understand that they have inherent worth and dignity as a human being. Victimhood culture sort of falls in between those two things, where status is gained based on one's claims to victimhood. So the more that one talks about that, the degree to which one might be in danger because of microaggressions, or Donald Trump's going to come along and get them, or whatever, which are usually hyperbolic and completely unsound and untrue gain traction because that person is making a claim to victimhood. And in a victimhood culture, that grants you a great deal of status. And the other thing that'll grant you status in a victimhood culture is standing up on behalf of the victims. So victimhood culture is about following a victimhood narrative rather than looking at the, true forms of oppression which exist for sure. But the reason that I think people feel so discontent and hollow is because uh in counseling right now is is because they're treating a false and hyperbolic narrative as if it's truth because the way that status is granted within the university system generally and counseling specifically has changed, and now its status is granted based on the degree to which one can lay claim to victim status, which again, this is really dangerous because what some people have talked about the emergence of the woke right, and what they're talking about there is the identitarian right. And this tends to be, people who are going to come in and I was actually accused of this. This wasn't what I meant at all when I spoke out and made my video about how the idea of whiteness was incredibly bad. People thought that I was saying white people need to look out, and that wasn't what I was saying. What I was saying is racialization is a really bad idea and we shouldn't do it, because what part of what will happen, A, it will become permissible to engage in racialization as a method of social change, and that will spread out so that people are going to endure oppression, and it's going to land on the steps of the people who are least able to defend themselves against it. And B, and I think this is a lesser threat, but it's a true one. If victimhood status works, you're going to see, and we are seeing, the emergence of, really kind of pathetic people who are saying, "Oh, I'm oppressed as a white person," or whatever. They're engaging in the same kind of, like, really, unsavory, identity politics that got us in this mess in the first place. So victimhood culture is just as dangerous as racialization because we've strayed now from truth and gone into narrative, and narrative can be co-opted. And true social justice, true justice of any type is predicated on the good faith search for truth. And anytime that you move away from that, you are starting to engage in power games rather than truth games. And that gets people killed. That gets people hurt. And we should really be moving away from that.
Yeah, it's really bizarre. I mean, there's no rule that you have to follow that these tools have to stay in one particular toolkit with critical social justice. Critical theory doesn't have to be anti-white. It could just as easily be anti-black, and you
It
see
absolutely could.
red pill philosophy and alt-right and these type of people using standpoint epistemology in this same exact toolkit for different aims.
Right.
These tools are very dangerous no matter whose hands they're in.
That's right. And that's what's so incredibly dumb about what the universities have done. Like, it's the level of ignorance that universities have displayed in allowing this to happen absolutely stuns me. As I started out by saying, this is dismaying that universities have allowed identitarianism to go on. Like, if there's a lot of people in counselor education right now who absolutely hate Trump and everything that Trump stands for. What they don't seem to understand is has access to the same games that they're playing. And so you heard this in Trump's first term with when he came up with the concept of alternative facts, right? What he was really saying was my lived experience of my inauguration was that a bunch of people were there. And it's how do you not see that in talking about lived experience,
Same concept.
you've it's the same concept, and you have given up the most powerful, effective engine of justice and progress that you possess in this free society, and that is the search for and the appeal to truth rather than perspective or experience or anecdote or whatever. The fact that not every professor in the university system is standing up immediately and making that point in the face of concepts around critical social justice like lived experience and so forth is baffling. Well, I guess it's not baffling. It displays, there's way too much true believership and way too much cowardice in the current university system. I guess it's a time of great societal change right now, but the dismay that comes with recognizing that the university system and counselor education is essentially failed is hard. But maybe something more resilient will emerge.
So we talked about how this ideology, critical social justice, has infiltrated academia. It's taken over the counselor education, grad programs for counseling. How is it affecting therapy as a profession?
This is really dangerous. This is extremely dangerous. And that gives me the opportunity to send out a plug for an organization that I've created that's called the Society for the Ethical Practice of Psychotherapy. It's at ethicaltherapy.org. And we actually have a meeting on Thursday, the 24th at 4 o'clock. And you can go onto our website and join us by Zoom. And we're just going to get together and talk. But what's going on now I'm going to, excuse me for one moment. I'm going to plug in my computer and then I will finish my thought. If you
Yeah.
will grant me 10 seconds. I should have done this before we started.
Here, I'm going to stop real. All right, we're back live again. Or not
Okay.
live, but you're
Yeah,
recording.
right. So we're recording.
Yeah.
So the question was like, how is this showing up in therapy? And what you're starting to see for example, I'm a member of SESNet, which is it's a listserv for counselor educators. And what you've seen over time is people used to it wasn't politics should be finding their way into the therapy room, but nobody would say that, progressive politics, that is, because the American Counseling Association expressly forbids it. It's in the ACA Code of Ethics that we do not impose our values on our therapy clients. And there's a really, really, really good reason for that, is that clients come in a state where they are extraordinarily vulnerable. And they are open to exploitation. And what's happened in critical social justice is the degradation of Enlightenment values, including traditional codes of ethics. Because in a society that's based on equality and humanism and the Enlightenment, you consider the position of individuals and you look at a situation in which individuals are vulnerable and then you act accordingly. So we have the ACA Code of Ethics saying we don't exploit our clients sexually or ideologically or religiously or in any other way. In a profession that is guided by the critical assumptions that everything is about power, it's then under that thought system permissible to include therapy patients in that game because we're no longer concerned with them as individuals. We're concerned with them as a composite of identity group. So a Black client, we need to make them an activist who advocates for progressive ideas of Black identity. For the white person, we need to make sure that I just saw this on CESNet the other day. Someone put out a notice that people should read this book on intersectional feminism in order to learn ways that they can help their patients understand how they are contributing to a harmful capitalist society or something like that. So under a system that's governed by the assumptions of critical social justice, which is that everything is predicated on power differentials, it's now permissible to see a person not as a vulnerable individual, but as a composite of their identity. And it's now permissible to use them as a tool to help this good ideology progress. So this is now 5 years ago. People were kind of saying we shouldn't impose our values on our patients, but now people are just outright saying we need to help our patients understand their privilege. And there's an article out there that's just awful, but you can read this where it's called Talking with Your White Clients About Race.
Mm.
It's open access. But the person who wrote this essentially takes you through step by step how to manipulate your patients into adopting progressive views on race, and how to justify incorporating this process into their treatment goals. So for those who are not true believers and who are aware of what's going on and who are aware of the vulnerability of counseling patients, this is a travesty of responsibility. And so the Society for the Ethical Practice of Psychotherapy, I co-created this organization as a patient advocacy organization. And we essentially do two things. We're there to provide fellowship for people who don't want to toe the line and who are concerned about patients who might be subject to indoctrination by critical social justice therapists. But we're also there to provide continuing education options for therapists who are forced to include critical social justice to get their license. So, for example, Vermont just passed a law that in order to get and maintain your license, you have to have 1 credit hour or 1 credit of continuing education in anti-oppression and cultural humility, which, boy, those sound great, don't they? But when you look beneath the surface, you find that cultural humility means setting aside your individuality and accepting uncritically someone else's reality. It's essentially introjection. Now, we want to replace your beliefs with our beliefs. And if you don't do that, you're not humble or you're not a good person. So anyway, what we're going to do at the Society for the Ethical Practice of Psychotherapy. Oh, and by the way, the Vermont law stipulates that this training must be real time and synchronous. And the reason that they want to do that is for the exact reason that you started out asking me about the group process with professors. The reason they want this in real time and you can't just go in and look at some slides on cultural humility or something is they want to take advantage of the group process to shut down the process of critical believing and start the process of critical thinking, to shut down the process of critical thinking and to start the process of uncritical believing. You need to have a group process there pressuring a person. That's how the introjection takes place. So this law stipulates that it has to be real time. And so what we're doing is we're going to provide sort of a counter training that's titled Healthy and Unhealthy Approaches to Anti-Oppression and Cultural Humility. And so that's what the Society for the Ethical Practice of Psychotherapy is there to do. It's there to help reaffirm Enlightenment principles as the guiding star for the profession of psychotherapy, to move back towards truth orientation and away from a power orientation.
That seems A, so refreshing, but B, so common sense to me. Client well-being comes first, and the best evidence as to how to get the client well-being matters. I mean, that sounds like just so common sense. And I'm wondering if we could flesh out a little bit how you would get to a different position. And so it seems like you've got this, like the traditional therapy is you kind of ignore the rest of the world, and it's like right here, this therapeutic relationship with one client or a couple or a small group, but what's happening in the room is like the primary thing that matters. And boosting the well-being of those who are in the room right there with you. And this kind of postmodern approach seems to say, well, you're ignoring context, right? What's outside the room matters too. And you kind of follow that rabbit trail until you get to, well, big political structures and systemic institutions, that's what's really driving all this. So individual well-being is kind of irrelevant without that bigger factor. Therefore, kind of your primary goal should be kind of elevating the critical consciousness of your client to change political structures. And before you know it, it's almost like bizarro world. It's like the opposite of therapy in a lot of ways.
It absolutely is the opposite of therapy. If therapy is about opening a person's horizons, critical social justice is about closing them down. So that because again, the danger that advocates of critical social justice have to contend with is the possibility that if critical social justice principles are taught about in a way that invites critical thinking, it's highly unlikely that critical social justice would survive that process. So the beliefs underlying it are so flimsy that you don't want to do anything that's going to invite thinking outside of the narrow parameters that critical social justice advocates set for discussions.
What is the effect if a client buys into this? If a client buys into this worldview of everything in the world around me is oppressor versus oppressed, there's oppressors lurking around every corner. Uh, I need to see myself as a victim. Like if somebody buys into that mentality, that's going through these counselor education programs and into newly trained therapists, if the client buys into that, what can we expect from the client and their individual psychology?
Well, Lukianoff and Haidt, I think, tried to tackle this issue in their book, "The Coddling of the American Mind," where they make the point and it sort of bring the receipts and the evidence that there's right now essentially a mental health crisis among the younger generation who have been brought up with social emotional learning and critical social justice sort of serving as the substructure of their education. So we could use that as a model and say the end result of this is going to be a great deal of anxiety and depression. I don't think that quite captures, though, the pain, the discomfort of being introjected. The what it is Stockholm syndrome, I think, is what it
Yeah.
is sometimes called, but it's essentially where a person will identify with an intimidating person or a powerful another, someone who has the power to hurt them in some ways, and they'll adopt uncritically that person's point of view. And that is just a soul crushing thing. When I was seeing this going on in counselor education, when I felt from the profession, wanting to introject me, wanting to replace my individuality, my thoughts with the premises and observations of critical social justice and so-called anti-racism. It made me physically very, very sick. I was just throwing up all the time, sometimes daily, and I wasn't sick or anything. There was nothing wrong with me. It was just so upsetting to have this, on SESNet, every in counseling articles, everywhere, this force is saying, you must believe what we believe. You must teach what we tell you to teach. I walked away from counselor education. I walked away from a tenured position for life. And I didn't think it was a problem just with the university that I was at. I thought it was a problem in higher education as a whole. And so I guess I know in some ways a little bit what it's like to be a whole profession trying to introject you, to insert their belief system into your own, to replace your belief system with theirs. And for me, it made me physically sick and it made me feel terrible and it shook me to the core of my being and just made me feel just like I wanted to take a shower. Now, and I was fairly well fortified against this. I was well read. I had a PhD. I had the luxury of having access to academic books and articles, so I could go in and find out what was going on behind the scenes in this ideology when the concept of so-called anti-racism was coming out in around 2019. A lot of people, psychotherapy patients, they don't have those resources or that luxury, to stop and, oh, let me go back and look at why the principles of the Enlightenment are important and why they should be preserved. What they have is a counselor, if it's a true believer, in a very manipulative way, waiting until the therapeutic relationship is very important to that patient, and then slowly inserting the beliefs while the patient is experiencing the threat of abandonment. That if I do not do what this counselor wants me to do, they might terminate the therapeutic relationship. I have patients, many, many, many patients, who expect me to set parameters on our relationship, or I might not want to see them anymore. They think that their situations are too difficult. And if they tell me what their situations are, I might not want to see them. They think that they're not attractive enough. And if they're not attractive, then I might not want to see them. So believe me when I say, if I were hinting that I'd really like it if a patient of mine would adopt this ideology, that I think it would be very good for them to adopt, I absolutely guarantee that 99% of them would do it just to please me. And we've always known this. This is why we go to such lengths to protect psychotherapy patients from sexual exploitation, because the therapeutic relationship is incredibly important to psychotherapy patients, and they'll do almost anything to preserve it. And that's before we even talk about the diminished ego strength associated with psychological distress. And so I don't know, it's almost beyond belief that counselors are doing this. And if I hadn't just seen it yesterday, it would be beyond belief that counselor educators are saying that this is a good idea.
It's the way you're presenting it seems so much more nefarious and just unethical. I mean, like you're taking a vulnerable population that is not necessarily completely mentally or emotionally stable at the moment, who's trying to lash on to someone for help, and you're not even upfront about it. You're slipping this in, kind of surreptitiously. It's this is disgusting.
Well, and what I'm saying is not an exaggeration. If anyone cares to go and read that article, Talking with Your White Clients About Race, the person who wrote this even says, don't wait until the therapeutic alliance is established before you start this process. And they sound perfectly, if you don't understand what it is that the person who wrote this is suggesting, it's written in such a way that it would seem reasonable. He's saying, don't pounce. It'll be too much if you throw this at a patient all at once. But at a process level, what this person is suggesting is wait until the therapeutic alliance is really important to this person, and then subtly begin to challenge things like Martin Luther. He even says this in the article, subtly challenge Martin Luther King's vision of color blindness. And it is insidious and it is gross. And I'm fully sympathetic to those people who call this grooming. I'm not quite sure if I want to use that term, but I'm considering it carefully. Because I think that it's probably appropriate. I don't understand why it's not. The only hesitancy I would have in not calling this grooming is I don't think I want to diminish the impact of that sexual grooming has on vulnerable people, because counselors can groom their adult patients to have sex with them, and that absolutely happens. And I don't want to diminish that process by suggesting that this is a parallel process. But at the end of the day, I think it might be. And the only difference is that, well, not the only difference, but the reason this is allowed to go on is because the profession is sanctioning this, and they're sanctioning it because people are too afraid to come out and take a stand against this, or probably a small but growing percentage think this is absolutely a permissible thing to do. That to see patients as,
Potential converts.
well, absolutely as potential converts, but to not see them as humans, to see them as composites of either oppression or oppressed, and to get them to act accordingly based on progressive assumptions.
I've got two questions left for you. The first one is, how do we fix the therapy profession?
Well, we let the crazy wither on the vine. And so one of the things that has happened in recent years is that the American Association of Mental Health Counselors has split from the ACA. And if you compare the ACA to the American Mental Health Counselors Association, and you look at their code of ethics, the American Mental Health Counselors Association has left in the component stating that you do not indoctrinate your patients, whereas the American Counseling Association has that in their current code of ethics. But they've also adopted, the Multicultural and Social Justice Counseling Guidelines, which explicitly states you should indoctrinate your patients and encourage your patients to indoctrinate their friends and family. I mean, it says that blatantly. And so the American Counseling Association has chosen to say two conflicting things. And so what we do is we do not renew our membership in the American Counseling Association, and we do join the American Mental Health Counselors Association. And So we vote with our feet. Like that is one thing that is very important. The other thing that we could do that would be really great is to encourage universities like the university. I think it's the University of Austin that Barry Weiss.
Mm.
Yeah, in Austin,
Yeah.
Texas, right?
Yeah.
Uh, we encourage universities like that to develop counselor education programs. And it'll be a slow change, but it will change over time. Again, the only thing that allows critical social justice and anti-racism and all of its toxic cousins to flourish is that they're predicated on the maintenance of belief through fear. And eventually that strategy will not work. But it's a slow process to create alternative organizations. I think what is less likely to produce a change, it's almost sort of a hope at this point, would be that, a leader would stand up and say, the American Counseling Association has gone in the wrong direction for a number of years now, and we're now going to take it in a different direction. I don't think that's going to happen. So one of the forces of liberalism, aside from free speech, is the free market. And so what we need to do, one other thing that we can advocate for is an alternative to KCREP, because KCREP has clearly been captured by critical social justice. And we need a non-critical social justice accrediting body. And we need to encourage states to maybe even discourage them from accepting students from KCREP programs, encourage them to accept students from some alternative accrediting body program once it becomes known generally what KCREP and counselor education programs are up to. I could see that happening.
Mm.
But yeah, we want to make sure we want to take advantage of the free market, and things like KCREP have been interfering with that because KCREP requires that critical social justice now be included in counselor education programs. And what that does is that doesn't allow critical social justice to die the death that it would were it not artificially kept alive by illiberal systems, in this case, KCREP.
I'm so glad you brought up K-Crap. I had a lot of anger towards my program at the beginning, and then I kind of understood what K-Crap was, and I realized they're just teaching what they're required to teach. Yeah.
I do think one of the things that I think counselor educators could do, and this isn't easy because oftentimes cohorts of students will be indoctrinated into this ideology, and it'll be considered sexy and edgy to like go against the professor who's going against the grain. But if people wanted to teach what KCREP is requiring, one of the things they could do is teach John McWhorter or Coleman Hughes alongside of Ibram X. Kendi. I don't know a lot of people who are doing that. That was certainly something that I endeavored to do. But the person who does that now is the person who stands out and who has a target painted on them. So, you really set yourself up.
I mean, I learned in my program that color blindness is a form of white supremacy. So you have to really be willing to step out on a limb to do that.
Well, and it's, we were talking earlier about language and how language is used to facilitate belief. And one of the words that's been, anti-racism is one of the words that's been mutilated in the service of this ideology. Another word or term that has been mutilated in the service of this ideology is white supremacy. That they've conflated, a preference for one race over another with not accepting a progressive view of the world and society, which interestingly is, exactly what someone who thought the patriarchy was really cool would do. Like, oh, I'm going to change people's language and force them to think the way I want to think. And it's like, wow, you're really, that's,
Not
how patriarchal of you.
not obsessing about race makes you a racist. Yeah. So my final question for you is, when you look at society more broadly, what is one issue that we're not talking about enough that we should be talking about more?
We should be talking about gullibility, not on the right or the left, but gullibility in general. I think there should be counter gullibility training. And Leslie Elliott Boyce has Carrie
Smith.
Smith as a teacher educator. They should watch what Carrie Smith is doing with counter
deprogrammed.
Yeah, they should watch what she is doing with counter gullibility training in
Yeah.
schools. And she's demonstrated that this can work really well with kids, and it doesn't have to be ideological. But you train people how to resist gullibility, and that's good for everybody, except for the political extremists. And that's what we should be talking about next.
That's interesting. I think it's so fascinating to me that a lot of woke people, critical social justice people, hate the concept of logic. Because logic would dismantle their ideas.
That's right. People on the extreme right hate it for the same
That's
reason.
true. Yeah, absolutely, absolutely. Yeah, very true. Well, Dr. Kindsvatter, I love this conversation. It was so fascinating. Thank you for joining me. I would do this again anytime.
It was a real pleasure, Ryan. It was so nice to meet you. And for anyone who's interested, please go to ethicaltherapy.org and join us for free at the Society for the Ethical Practice of Psychotherapy.
Yes, please do.